Welcome to our video on goniometry of the upper limb. Goniometry is a crucial technique for measuring the range of motion in your joints. In this video, we'll explore how to measure the movement of the shoulder, elbow, forearm, and wrist. Understanding these measurements is essential for assessing joint function and tracking progress in rehabilitation. Let's get started. Now, let's talk about the basics of measuring joint movement. We use a tool called a goniometer to measure these angles in degrees. The main purpose is to assess your range of motion, keep track of any changes over time, set therapy goals, and provide valuable data for documentation and research. We measure both active and passive range of motion. Active range of motion is the movement you can make on your own, while passive range of motion is how far your joint can be moved by someone else. It's always important to compare the measurements to the healthy, unaffected side. For accurate measurements, first, explain the procedure to the person and ensure their comfort. Position them correctly and stabilize the part that remains stationary. Place the goniometer's fulcrum on the correct anatomical landmark. Align the stationary arm with a reference point and move the movable arm along the other limb segment. Record the starting and ending angles, noting any pain or restrictions. Take a few readings for accuracy and document any unusual movements. The normal range of motion for shoulder flexion is from 0 to 180 degrees. To measure this, position the person either lying on their back or sitting. Place the fulcrum of the goniometer on the lateral aspect of the greater tubercle of the humerus. Align the stationary arm parallel to the mid-axillary line of the thorax, pointing towards the armpit. Move the movable arm along the lateral midline of the humerus towards the lateral epicondyle. In the image, you can see a person raising their arm overhead, and the goniometer is positioned to measure this range of motion. Ask the person to actively raise their arm overhead and record the maximum angle. For shoulder extension, the normal range of motion is from 0 to 60 degrees. Position the person in a prone or standing position. Place the goniometer's fulcrum on the lateral aspect of the greater tubercle of the humerus. Align the stationary arm parallel to the mid-axillary line of the thorax, pointing towards the armpit. Move the movable arm along the lateral midline of the humerus towards the lateral epicondyle. Ask the person to move their arm backward while keeping their elbow straight. The image shows a person moving their arm backward, illustrating shoulder extension. Shoulder abduction has a normal range of motion from 0 to 180 degrees. The person should be supine to minimize scapular's movement. The fulcrum of the measuring device is placed on the anterior aspect of the acromion process. The stationary arm is aligned parallel to the anterior midline of the sternum. The movable arm is aligned along the midline of the humerus towards the medial epicondyle. The image shows a person raising their arm out to the side and overhead, demonstrating the motion of shoulder abduction. Next, we have shoulder external rotation with a normal range of motion from 0 to 90 degrees and internal rotation with a normal range of motion from 0 to 70 degrees. The person should be supine with their shoulder abducted to 90 degrees and their elbow flexed to 90 degrees. The fulcrum of the measuring device is placed on the olecranon process of the ulna, which is the center of the elbow. The stationary arm is positioned perpendicular to the floor or parallel to the table surface, aligning with the humerus. The movable arm is placed along the ulnar shaft toward the ulnar styloid. For external rotation, rotate the forearm away from the torso. For internal rotation, rotate the forearm toward the torso. The image shows the measuring device placed on the elbow with the person's arm in the proper position for measuring these rotations. Next, we have elbow flexion, which has a normal range of motion from 0 to 150 degrees, and extension, which is normally 0 degrees. The person should be supine or sitting. The fulcrum of the measuring device is placed on the lateral epicondyle of the humerus. The stationary arm is aligned along the lateral midline of the humerus, toward the acromion. The movable arm is aligned along the lateral midline of the radius toward the radial styloid. Ask the person to bend their elbow, flexion, and then straighten it, extension. The image shows the measuring device placed on the elbow, measuring the angle of flexion. Next, we have forearm pronation and supination, each with a normal range of motion from 0 to 80 degrees. The person should be seated with their elbow flexed to 90 degrees and their forearm in a neutral position, thumb pointing up. The fulcrum of the measuring device is placed over the ulnar styloid, on the dorsal surface of the forearm. The stationary arm is held parallel to the midline of the humerus. The movable arm is placed across the dorsal aspect of the forearm. For pronation, rotate the palm down. For supination, rotate the palm up. The image shows the measuring device placed on the forearm to measure the range of motion. Next, we have wrist flexion with a normal range of motion from 0 to 80 degrees and extension with a normal range of motion from 0 to 70 degrees. The person should be seated with their forearm supported, palm down, and hand relaxed. The fulcrum of the measuring device is placed over the lateral aspect of the triquetrum of the wrist. The stationary arm is aligned along the lateral midline of the ulna toward the olecranon. The movable arm is placed along the lateral midline of the fifth metacarpal. Ask the person to bend their wrist downward, flexion, and then bend it upward, extension. The image shows the measuring device placed on the wrist to measure the range of motion. Next, we have wrist radial and ulnar deviation. Radial deviation has a normal range of motion from 0 to 20 degrees, and ulnar deviation has a normal range of motion from 0 to 30 degrees. The person should be seated with their forearm pronated and their hand flat on a table. The fulcrum of the measuring device is placed over the capitate of the wrist, or at the base of the third metacarpal. The stationary arm is aligned along the midline of the forearm toward the lateral epicondyle. The movable arm is aligned along the third metacarpal. Ask the person to move their hand toward the radial side and then toward the ulnar side. The image shows the measuring device placed on the wrist to measure the range of radial and ulnar deviation. Next, we have thumb CMC abduction. The person should be seated with their forearm neutral. The fulcrum of the measuring device is placed on the lateral aspect of the radial styloid, or the trapezium area. The stationary arm is aligned along the lateral aspect of the second metacarpal, or radius. The movable arm is placed along the first metacarpal. Ask the person to move their thumb away from the palm and measure the angle of abduction. Let's discuss the measurements for the fingers. For the metacarpophalangeal joint, or MCP, flexion, the axis is placed over the dorsal aspect of the MCP joint. The stationary arm is aligned along the metacarpal, and the moving arm is along the proximal phalanx. For the proximal interphalangeal joint, or PIP flexion, the axis is over the dorsal aspect of the PIP joint. The stationary arm is along the proximal phalanx, and the moving arm is along the middle phalanx. For the distal interphalangeal joint, or DIP flexion, the axis is over the dorsal aspect of the DIP joint. The stationary arm is along the middle phalanx, and the moving arm is along the distal phalanx. The procedure involves stabilizing each segment to prevent substitution and bending the fingers sequentially. Thank you for watching the video. I hope you liked it. Like, comment, and subscribe for more, and I will soon upload the second part of the goniometry of the lower limbs.